Well, first of all, I would like to wish everyone a successful Congress. I will try and talk about two topics that are pertinent to our discussion today. During the first part of my presentation, I will be talking about impulsivity and impulse control disorders. And then I will be talking about non-obsessive compulsive disorders. My colleague Elif talked about these. Let me define compulsivity though. In contravention to impulsivity, it is something that is done to avoid or prevent a negative outcome, and this irrational behavior is repeated recurrently. This was proposed by Hollander in 2006. Certain diseases that have common features with impulsivity, ADHD, and of course impulsivity is the shared feature between all of these different conditions. Also, very briefly, let me show you the dimensions of impulsivity: motor impulsivity, cognitive impulsivity, reward impulsivity. I will go into details shortly, but the one that is associated with OCD is cognitive impulsivity, because response inhibition cannot be prevented in no-go tests, and reward impulsivity is more prominent when it comes to addiction. In OCD, there are certain impulsivity studies. When we look at these studies, we see that aggressive asexual OC patients have a positive relationship. There is a positive correlation with impulsivity, and this study reveals that OCD patients are more under risk in terms of this. Yet another study, OCD patients and regular populations were compared. Only cognitive compulsivity was higher in OCD patients. There was no correlation with motor impulsivity. So we believe that there's a specific relationship between OCD and cognitive impulsivity. And the fact that there is no relationship between OCD and motor impulsivity stems from the fact that there is perfectionism and avoidance of errors in these patients. Also, there is another study on perseverance, and certain types of obsession are observed only in men, whereas some are only associated with impulsivity in women. And the authors of this study say that gender plays an important role in all of this. Yet another study, over-responsibility in OCD patients, perceived impulsivity as a modulating effect. Impulsive behaviors and compulsive behaviors, these are two different ends of the spectrum, it is proposed. Let's now take a look at the differences. One is behaviors that can result in harm. The others are ritualistic. In compulsion, it's ritualistic and based on avoidance of harm. In the first one, the main motivation is about seeking of reward, pleasure or excitement, whereas in the compulsive behavior, the basic motivation is reducing anxiety. And in impulsive behavior, you see borderline and antisocial features. In compulsive behavior, there is no such thing, and in impulsive behaviors, it is egosyntonic, whereas in compulsive behavior is ego-dystonic, and impulsive is associated with ventral striatum, whereas the other one is associated with dorsal striatum. But of course, there are gray lines as well, in both cases, in impulsive and compulsive behaviors as well. And in disorders related with them, there are certain fluctuations. OCD patients, 30% of them have egosyntonic behavior in impulse disorders after a certain stage. Behaviors seem egodystonic to the patient. Hoarding and symmetry obsessed OCD patients have a special emotion connected to the rewarding system, and also in certain types of impulsivity, anxiety is reduced. As I previously said, in contradiction to the brain imaging I showed you, in OCD patients, despite the fact that there is a relationship with the dorsal system, in certain patients, ventral systems also come to the play. And compulsivity and impulsivity may not be opposite ends of the same spectrum, and the relationship between the two seems interconnected and complex. Diseases that encompass compulsivity and impulsivity. On the one hand, you see OCD, on the other one, antisocial behavior, personality disorders, and of course there are impulse disorders in between, and some of these are classified in DSM-4. This is a spectrum. This is also entitled the OCD spectrum, but it has been narrowed down. In a recent study in patients with poor insight, with low resistance towards impulsivity, are classified as impulsive OCD patients, and were compared with non-impulsive OCD patients, and impulsive OCD patients had a bit worse prognosis, and they suffered from severe hoarding and compulsive behavior and certain comorbidities. And the authors say that impulsive OCD patients may not find OC symptoms irrational and may get pleasure out of doing executing compulsions, and may benefit from non-traditional, conventional studies. This is a study that was conducted on 901 OCD patients. You see the rates up on the screen. Pathologic skin damage is the most common one. Impulse control disorders and how OCD is affected by them. The onset age is much younger. Symptoms are much more severe. There are more attempts at SSRI treatment. Pathology is much more widespread, and severe response rate is rather low. Functionality, quality of life is impaired much more, and there are more anxieties and comorbidities involved. And counting, symmetry, and hoarding compulsions are much more, according to this study. That's why in OCD patients, the fact that there are impulsives or comorbidities sort of aggravate the severity of the condition. Now let's talk about phenomenology. APA, in their impulsive behavior description, before the behavior there was anxiety and arousal, whereas after the behavior there is pleasure and a sense of content, being content. For trichotillomania, this was taken out of context in DSM-5. According to APA, impulsive is towards seeking pleasure. And again, yet another theory that was devised recently says that these both impulses and compulsions are actually about emotion regulation, both seeking of the reward and avoiding of damage is about emotion regulation. Compulsivity and impulsivity is inherent in these acts, and both of these behaviors are done to achieve emotional regulation, it is postulated. Yet another common feature is low-level recurrent behaviors, as I previously said. Now, certain OCDs, impulse control disorders, fall within OCD, and this is because repetitive behavior, and this is akin to the grooming behaviors in animals, and self-stimulation here serves emotional regulation, picking off the skin, biting the nails, pulling off the hair. These can all be examples. Many comorbidities, genetic and family styles show the relationship of OCD with grooming behaviors, but it also shows that there is no relationship with other impulsive compulsivity disorders. We know about DSM-4, kleptomania, and DSM-5 does not have that. No kleptomania and pyromania, and some remain the same. And there have been certain additions, and also the title of the chapter has been changed in DSM-5. And there's a new group entitled Obsessive-Compulsive Disorders, trichotillomania, and picking off the skin is here. Also, there's a new diagnosis for hoarding, and body dysmorphic disorder is also included here. Conclusions. Cognitive impulsivity seems to have a specific relationship with OCD. There are different types of impulsivity, and these may have associations with other symptoms, specific symptoms of OCD. Compulsivity and impulsivity share many features, and they are intertwined to a certain degree. Trichotillomania and OCD also have many features, many common features. This is all I have to say. Thank you.